in Massachusetts, which started yesterday. The public health data continues to trend in the right direction. As of yesterday, we've done over 650,000 tests, which makes us a top 5 per capita test player here in the United States. And if we were a country, we'd be one of the top testers on a per capita basis in the world. The average positive test rate is now down to around 4.9%. That's obviously a very significant reduction, over 60% reduction in the number of positive tests as a percent of tests done over the course of the past month. The number of people who remained hospitalized due to COVID is down to about 1,462. That's obviously down dramatically, over 50% since the middle of April. And we continue to anticipate and hope that we see those positive trends as we continue to move forward in phase 2. We'll also continue to expand our testing capacity here in Massachusetts and our contact tracing activity as we move forward. I mean, throughout this crisis, we've been pretty aggressive about expanding our ability to provide information that's particular and important to COVID-19 to the public. And yesterday, we filed an act to ensure the collection of COVID-19 data, which builds on the legislation that was recently passed by our colleagues in the legislature that we signed into law on Sunday night. COVID-19 has obviously taken a tremendous toll on the residents of the Commonwealth and has disproportionately impacted certain populations, including older residents and folks in communities of color. This bill that our administration filed will expand our data collection capability to help address the health disparities and the information that's available with respect to these communities. Currently, the law makes clear that DPH is required to collect data on COVID-19 cases and patient demographics, but what's not so clear is what the provider community and the lab community has to submit to DPH. Since the integrity of DPH's data is dependent on what we get from those entities, this bill would amend the reporting law to require that that information be reported by those other participants in the data collection and service delivery supply chain. We believe that this will help improve the spirit of the law to have accurate and complete reporting and to have everybody who's part of that process compelled to actually deliver the information that we'll be looking for on a timely basis. That, in some respects, gives us the ability to ensure that we get the data we need in the most complete form possible. And for those who don't file under the legislation we submitted, DPH would have the ability to issue fines to those who don't deliver the data. We're also proposing other amendments to address data collection and aggregation. The new law that I signed requires designated elder care facilities to report COVID-19 data for residents and staff. Certainly, improved data collection makes sense for nursing homes and skilled nursing facilities who play a critical role with respect to patient care, but the law also includes elder housing complexes, which could come with a few problems. Landlords, generally speaking, do not and should not have access to a tenant's private health care records, nor should they have the burden of reporting that to the Department of Public Health. Our legislation would remove elder housing complexes as a designated reporter. It also includes language to allow DPH to lawfully aggregate this data. Accurate and detailed information is an integral part of our understanding in fighting COVID-19, and we continue to support efforts here in Massachusetts to expand and enhance our capacity to deliver on that. There are also a number of important components to the bill that we signed into law that everybody agreed were the right thing to do. We're hopeful that the new legislation will help put a finer point on data collection for seniors and ensure that DPH has access to complete information to identify infection rates and health disparities across the Commonwealth. And we look forward to working with the legislature to pass these updates to help further ensure that we get the information we need and that we can do what needs to be done to address health disparities affecting these communities.